Let's now tell you that the Yobe State government has confirmed the death of 26 patients who contracted diphtheria disease in the state. About 21 people are still receiving medication at various isolation facilities. The senior special assistant to the governor, Lawan Gana, told reporters that 289 patients have been discharged across facilities in the state. Our correspondent in Yobe, Michael Oshoma, joins me live from Damaturu. Michael, what more are you learning about this new development? How many active cases are we looking at, and how many local government areas have been affected?
Yeah, presently, according to the information available to us by the Ministry of Health in the state, 21 active cases have been recorded and 26 deaths, and 289 treated and discharged patients so far. As we speak right now, there's an emergency by relevant stakeholders to tackle the unfortunate outbreak in the state. There is so much advocacy on sensitization, on disseminating information by using traditional rulers to sensitize the locals on the preventive measures for them to take to avert this outbreak in different local governments. As we speak right now, 7 local governments has been affected: Potiskum, Gulani, Nangere, Unguru, Damaturu, Busari, and Tarmua. But among all these local governments I mentioned, Unguru has the highest record of infected patients in this case as we speak.
Beyond the advocacies and sensitization on the part of government, what are you hearing about vaccination programs in this regard?
Yeah, according to available information released to the press, the senior special assistant to the governor says staff have been they are being trained on how to tackle this situation, and also there will be a kind of massive vaccination at the local government, at the 17 across the 17 local government areas in the state. They said they are not relenting to ensure that they tackle this, and also to ensure that all measures are being put in place to nip it in the bud.
Yobe State correspondent Michael Oshoma, thank you for talking to us. I will bring you Michael's detailed report on the diphtheria outbreak in Yobe in our subsequent bulletins. In Borno State, stakeholders are seeking adequate provision of micronutrient supplements and vitamins to children by government and humanitarian partners in order to mitigate the prevalent cases of malnutrition among them. Well, they made their views known at the end of a 3-day training on targeted supplementary feeding program in Maiduguri, Borno State capital. TVC News' Jesse Tafida has details, and we'll return with the business news.
Nigeria has the second highest burden of stunted children in the world, according to the United Nations Children's Fund. UNICEF also reveals an estimated 2 million children in Nigeria suffer from severe acute malnutrition. To address this, the Borno State government is collaborating with a non-governmental organization to train 70 health workers in areas of nutrition. The training is expected to build their capacity to provide prompt support to malnourished children.
When you train somebody, he go back and emulate those characters in the community. It's like a program that continues forever. So we're not training because we want to stay with them, but we're training because we want to hand them over the power. Most of the people who have been trained today for the past 3 days, they are all from different communities in 3 LGS of the state. So at the end of the day, we expect them to emulate whatever thing that we train them here, to make sure that the whatever we want, WFP want, or the state government want to achieve with this, we believe that it will come to pass.
The main objective of this training is to train those working at the health facilities in tackling moderate acute malnutrition in children 6 to 59 months, so that we can be able to reduce the level of undernutrition in our society. This particular program is being funded by the WFP, and we're working together with the state government in collaboration with the Ministry of Health and the Borno State Primary Health Care.
The trainees are cautioned to put on their best behavior while interacting with community members.
This workshop is very important because it has improved my skills, it has improved my capacity, which I believe it will be extended to the community. We should join hands. Let's put what we have learned into practice. I believe we're going to come up with a positive result.
I feel progress by this training because I have been impacted a lot of knowledge and insights about what I was ignorant of. The knowledge we have been impacted during this training will be manifested in the community subsequently when we go there.
The training will hopefully result in cases of malnutrition among children being drastically reduced. Jessita Fida, TVC News, Maiduguri.